All right. So yeah, Joe, this is considered, I wrote an article about 7 months ago, and the title was The Most Versatile Medical Device in the Last 25 Years That You Never Heard of. And we've now placed this successfully in over 105 clinics across the country. And we're seeing an average doctor is increasing their practices by 20 to 40%. And I'll get into the specific numbers in just a minute. You know, we were lucky enough to be featured in Forbes magazine in January 2021. This device has FDA 510 clearance for working with wounds, ulcers, and activation of connective tissue. We also have a class 1 registered to help decrease pain, improve circulation. So the Forbes article was really how we were able to sell 58 of these during a pandemic over a Zoom call. And so that's kind of what you're seeing.
That's cool.
Yeah. Again, with musculoskeletal type injuries, and this is with a technician, we're seeing 65 to 91% success rate. When you pair that with chiropractic and the ability to locate a subluxation, adjust it, remove it, and then place this on to help accelerate the body's natural healing ability, now you're at 80 to 91%. And we have over 133 peer-reviewed studies over the last 15 years. And, you know, we're really super excited. I'll go over a couple of them today as well. I talk about the ROII, right? The return on impact, like what this does in your community and your practice, and the level of people that you can then help now. And it's almost like we become an interventional orthopedist. And I believe that, you know, we're already a primary portal for people in our community, but let's face it, only 10% of the population will utilize chiropractic. This is 90% of the people that wouldn't even consider coming to see us. With this device, you will notice that you'll attract 100% of the people that are living in pain, and they don't care what the last 2 letters of your name are behind your name. So it's return on impact, return on investment. And that's what we're seeing in a lot of our clinics. This is, you know, there's only 610 in the world, and we have 175 in the United States. You see this at Shepherd Spine Center, one of the top rehab centers, hospitals in the country. We're at Cleveland Clinic, Mayo Clinic in the urology departments, University of California, San Diego, University of California, San Francisco. We're in 4 NBA teams, including the world champion LA Lakers. LeBron James is getting used this week for a high ankle sprain. We're on tour with Graham McDowell and the PGA. Pittsburgh Steelers, Chicago Cubs have 2 of them. Cleveland Indians have 1. So, you know, the biggest, getting in the NFL this past year was awesome. Dr. James Bradley, who's been with the team orthopedist since 1991, he calls it his secret weapon for recovery. And he wants to keep it a secret right now because this is the Steelers are the only ones using it. Dr. Martin O'Malley has had one for 8 years. He's a foot and ankle specialist for the NBA. He did Kevin Durant's surgery and actually had it in the OR. So he uses it to close because it helps reduce keloid and scar formation and accelerates the healing. And we also have an antibacterial and antimicrobial effect. Laura Rossler is one of our best Olympic hopefuls and gold medalists. Chance of getting a gold medal in Japan. And then again, Graham McDowell. You know, Dr. O'Malley, he bought it 8 years ago because his son had a non-healing tibial plateau fracture. And after getting success with his own family, he started implementing it into his clinic and you know, has now treated thousands of NBA players. There's nothing else like this. This is literally electrohydraulically produced sound waves. It's the same technology they use for lithotripsy to break up kidney stones. That's been around for over 40 years, and they've had an 85% success rate. One of the coolest things I've seen in the last year is the spinal cord injury study that came out of Austria. I'm not sure if I told you about it, but they now have this in all 13 trauma centers in Austria. and they made a national health mandate that if anyone has a spinal cord injury, that they get this treatment done within 72 hours. And in the short 2 years that they've utilized this, they have had a 50% reduction in paralysis. So compared to the previous 20 years of keeping data. So this, what they found from this study is that they called it an innate immune receptor. It activates toll-like receptor 3, which downregulates inflammation. And Dr. Wolfgang Schaden's hypothesis was, what if we could, he realized that 9% of spinal cord injuries actually came from the trauma, but 91% of the paralysis developed 2 to 3 days later. So he thought, what if we could put help modulate the amount of inflammation in an area and decrease that inflammatory process. So that's what they did. That's one of the reasons why I called Dan Pompa after Daniel got injured, is because we had a device out there the week after he had those 2 spinal cord fractures.
Yeah, that's right. Yeah.
So it's episode 12 of our podcast, and I send that out to a lot of people. But just think about the cost on healthcare to take care of, they call it the cost of attrition, right? To take care of a paralyzed person. It can be overwhelming. So they're projecting that this is going to save them millions of euros. And just in non-healing fractures alone, Austria estimates they've saved 70 million euros in 10 years of using this. So you're going to see this in more trauma centers and hospitals across the country as well. This is probably my favorite slide. This is the mitochondrial. The green is before treatment, and on the right is after. So what you're seeing is the mitochondrial are being activated and working more efficiently. On the left is an anaerobic state, and on the right is an aerobic state, which produces more ATP and allows the body to replicate, regenerate, and repair better. This is one of my patients. She was one of our diabetic neuropathy patients. She had the worst cyanotic feet I'd seen ever. And this is after a 3-minute treatment. So we help release vascular endothelial growth factor that is imperative in the synthesis of nitric oxide, which will help create vasodilation. And you get this influx of oxygen-rich blood. We also are stimulating our own stem cells within 45 minutes of treatment, improve a bit of exosome circulation, and again, helps decrease pain, improve circulation. We have a cardiac division. We just sold the second one to Piedmont Hospital in the cardiac division because, did I tell you about the LVATs?
Mm-mm.
They have a left ventricular assist device. So these people who are with congestive heart failure that are waiting for a heart transplant, they either die because they don't get on the heart transplant list, or they get an infection in that internal lead that's helping their left ventricle pump the blood.
Right.
So they've successfully treated 7 of 7 infections in that. And now they're actually, after they put the lead in, they're actually doing it preventatively and using it on that area. And basically what we found is that wherever we place this on the human body, there's a positive biological outcome. And this is one of my favorite slides. So, you know, we are seeing all these different things. We're seeing stimulate the body, healing naturally. I mean, it pairs well with our philosophy, right? First, do no harm. This is a non-significant risk factor. It helps decrease pain. In our clinic, we keep every patient's like a case study. We're seeing us go from a pain level of 8 on the VAS score down to a 3.5 within 5 weeks. So most medications will only drop at 2.5, and it's for a short period of time. This is something we're following over a long time period. So decrease inflammation, improve blood supply. These are all what we're looking for. This is where most of the research has been done in tendinopathies, bone pathologies, and skin wounds, burns, and ulcers. So excited to see that because I think we're going to save thousands of people from amputations a year. I think I told you Cleveland Indians have, or Chicago Cubs have two of these. And we kind of stole a page out of their playbook because they have one in the PT room, right, for acute injuries, but they have another one that they utilize that all players during the season come in and get both shoulders, both elbows, both wrists, both knees scanned. Because if you run this over normal tissue, there's no pain. As soon as you get to an area of inflammation or damaged tissue or poor circulation, there's a biofeedback component where the patient says, right there.
It's crazy. I watched it.
You know it. You saw it
Yeah,
yourself.
man. Yeah,
So
yeah, yeah.
I actually created a patent pending protocol that you give us 10 minutes, we'll give you your life back. We're able to diagnose, locate the area of inflammation, really detect where the true source of the pain is coming from, and then turn it into more of the healing mode and start the healing process. And what I'm finding is this almost tricks the body into thinking there's a new injury without causing damage. And it's like resetting the pain, the healing cycle. Our body's good at taking care of acute injuries, but it's those long-term chronic things that kind of the body's like, no, I got to take care of these issues today. So it kind of resets that healing cascade and starts from day one again. Easy to implement. We've seen this, successfully moved into busy clinics already, and you can use your existing patients. We have it. Me personally, I've placed over 105 devices in the country. We're part of an elite squad of healthcare providers. You're bringing world-class technology to your community. This is an investment in your practice in your community. So, you can see where we need help. We need some people in Montana. We need one in Louisiana. We need one in Missouri. Oh, no, we got two in Missouri. Nobody in Maine. Nobody in Vermont yet. Delaware.
I got someone looking at it from St. Louis will be on this call, and then someone in Charlotte and possibly Pennsylvania.
Perfect. The more the merrier. I need 100 Joe Clarinos like you, man, to help me on this. And so, I've talked to over 700 doctors in the last 3.5 years of doing this, and most of them are concerned like, hey, can I physically keep up with these demands as I get older after I've been in the profession for 2 and 3 decades? Will I have enough money to retire, send my kids to college? This is the time, right? And I've found that this is like getting a golden goose, and every day this little goose, if you take care of it properly, will plop out a beautiful little golden egg. And on average, the people doing our marketing and have this device are collecting $1,200 extra per day. So it comes out to about $27,000 more per month. And, I just think this will work well with what you guys have been doing already. Obviously, increased revenue.
Well, yeah. So can you go over the numbers with them? Just go over the numbers real quick. We went over that before. Like, so what are you charging, and what's your typical case fee? How you doing that stuff?
Yeah, typically, it's 6 to 8 visits to get people to that 65 to 90% improvement. It's typical care plans are between $900 and $1,250 for short term. We can roll them up and do $3,000 and $4,000 plans as well for more like a 6-month program, and we're starting to develop that. But I have a huge neuropathy clinic for years here. We saw over 900 new patients a year, and with COVID, my average patient, 71 years old, they were gone. My neuropathy clinic evaporated, and we were shut down for 4.5 weeks. And when we came back, it was like I felt like I was 25 again, starting a clinic from scratch. And what I did is I partnered with this marketing group, and they were awesome at, I remember in April, we saw 12 patients. I was only open 2 half days a week. And in May, we did 35 new patients. And I was like, wow, if we keep this up, I can bring my staff back. By June, we had seen 50 new patients. I brought back 15 of my 17 staff members. July, we did 75 new patients. August, we did 120. September, we did 125. We've been averaging right around 120 new patients. And again, this is the Atlanta market, and we're spending some money, but we're driving people in. and getting people better. And again, you're attracting 100% of the people in